Hello, thank you for joining us today in this webinar. My name is Willem Bosma from Vetramil's from Bee Factory, and we represent Vetramil, a honey-based product line, veterinary product line for skincare and wound care. I have the honor to introduce to you Dr. Janice Huntingford, who will share with you some of her experience with our products, among other things. Dr. Janice Huntingford is a 1984 graduate of the Ontario Veterinary College, University of Guelph in Guelph, Ontario. And she's a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation. Dr. Huntingford is certified in chiropractic, acupuncture, rehabilitation, and pain management, and has a master's in traditional Chinese veterinary medicine from the Chi University in Reddick, Florida. Dr. Huntingford is the owner and medical director of the Essex Animal Hospital in Essex, Ontario, and an associate professor at the Chi University. She has published several peer-reviewed papers and is a frequent speaker at national and international meetings. When she's not speaking, practicing, or traveling, Dr. Huntingford spends time on her farm and winery with chef husband Harold and a menagerie of pugs, cats, horses, pigs, cattle, chickens, honeybees, and sometimes with her two beautiful granddaughters. Before we get started, I will review a few housekeeping items. If you have questions, please type them in the questions box. We have a packed presentation today, so Dr. Huntingford will not have time to answer questions live. However, she will follow up to answer your questions via email after the broadcast. This webinar is being recorded and will be available to watch on demand. And you will receive an email with the link when it's ready. I have the honor to give the word to Dr. Huntingford.
Well, thank you very much, Willem. Very happy to be here doing this webinar and letting all the other veterinarians know about how I like to use honey and wound healing. I see a lot of paralyzed dogs, and I just want general practitioners to know that although paralyzed dogs can be very difficult to deal with, and there's lots of challenges with them, that it is important to realize in first opinion practice, there's many things that you can do. So we will be talking about some of the things you can do in practice with your patients and how to help your paralyzed patients, whether or not you're a rehabilitation practitioner. But I'm going to encourage people to consider extra continuing education in rehabilitation because it's a fascinating field and it is extremely satisfying. But one of the things that we need to remember is that with these paralyzed dogs, we have challenges that arise for the owner, for the clinician, and for the dog as well. So the best thing that we can do is get as good of a diagnosis as we can, because the diagnosis is very important for the prognosis for these patients. And since I see a number of these patients, I can tell you that many of them are going to have wounds, and we would hope to prevent wounds if we can, but many of them come in already with wounds. So the Vetramil honey is something that I do use for some of these wounds, and I'll go over how that works. But there's also many other things that we're going to talk about. Some things like assisted devices, modifying the environment for these paralyzed dogs. So lots of really exciting things. And I just happen to be extremely passionate about rehabilitation and getting these paralyzed dogs better. So we better think about what is causing paralysis in these dogs. And generally, we're thinking that this is, of course, a spinal cord issue. Now, paralysis can be all four legs, obviously, tetraparesis, or we could just have the front legs or the back legs, which is going to be paraparesis, right? Just 2 or 4. When we have central causes of paralysis, say, for example, we have a brain tumor, things like that, those tend to have a worse prognosis. Our best prognosis tend to be our dogs that are paralyzed in only 2 legs rather than 4. And sometimes for these patients, we do require advanced imaging. So we may be looking at these patients, wanting to send them for an MRI or wanting to send them for a CT. But there's many things you can do in first opinion practice to figure out where the lesion is and what is going on. Now, the reason that you're going to send your patients for advanced imaging is not only diagnosis, but also obviously prognosis. And it may or may not affect your treatment. For example, obviously, if you have an acute disc injury and you have a dog that requires surgery for maybe a T3, L3 myelopathy, great to do an MRI. Your neurosurgeon's going to look at that, and he's going to be able, or she is going to be able to fix that problem. Those dogs then need to go on for rehab. That's where I come in. But in some cases, that's not in the cards for the client. They can't afford to do diagnostic imaging. So you can actually get an idea of how to localize your spinal cord lesion in first opinion practice without advanced diagnostics. So the first thing when we have one of these patients come in that we need to think about is this patient a neurological problem or an orthopedic problem? How do we determine that? Because I have had a couple of dogs referred to me that have had bilateral cruciate ruptures, and the referring veterinarians thought they had neurological disease. And they do, when you look at the gait, they do look very much the same. But here's the thing. Proprioceptive deficits are going to equal neurological disease. You will not have proprioceptive deficits with orthopedic disease. Then, of course, we look to see how many limbs are affected. Is it cervical versus thoracolumbar? Are we looking at things just in the lumbar itself or just in the brachial plexus? And really, spinal reflexes, if they're present or absent, are going to be very helpful. If you're not familiar with the crossed extensor reflex, the crossed extensor reflex is a normal reflex we see in the standing dog, or a horse. You pick up one front leg of the dog, he automatically puts all of his weight on the other front leg. That reflex when the animal is laying down is something that is dampened so that they don't automatically do that. However, if you're checking a dog laying down position and you find a positive crossed extensor reflex, you're then able to know, oh, upper motor neuron reflex, it's going to be C1 to C5, T3 to L3. And I realize this is a very fast review for this, but it's something you could always pull out your neuro book and have a look. 2-engine gait, maybe a C6 to T2 spinal cord segment or perhaps lumbosacral. Both ataxia and paresis can be present or only paresis. So if we only have paresis, we probably have lumbosacral disease. If we only have tetraparesis, we probably have neuromuscular disease. So this is a very interesting slide. You can always take a picture of this, think about how this works, but that's just a little bit of an overview when we approach neurolocalization in practice. So what are some of the challenges that our dogs are going to have with paralysis? And this is really from the owner's perspective, right? So these paralyzed dogs, it's a sudden onset, and many times, diagnosis can be difficult and maybe costly if we need to do an MRI or a CT. And one of the big things is that the dog is now fully dependent upon the owner. And especially with large breed dogs, that can be a very difficult thing because you obviously have to be able to move your dog around. Much easier with a dachshund or, a pocket poodle, much more difficult with a Rottweiler. So this is a challenge for the owner. But the biggest challenges that I find the owners really have with these dogs, rather than just moving them around, and can be any size dogs, are going to be challenges with bladder care and skin care. So dogs who have weak and leaky bladders, this can be a huge problem for the owner because the dog is lying there, urine is leaking out. We're having a problem with keeping the dog clean, right? We need to keep the skin from getting too much attached, too much in contact with the urine, because that can cause a huge issue if that happens. And we need to have integrity of the skin. So what do we do for that? Well, we want to prevent any kind of wounds, and that we want to help them with, soft washable surfaces, maybe diapers, things like that. There are medications that you can help these dogs with, but one of the things I want to remind practitioners about if they see these paralyzed dogs is to make sure they're palpating the bladders, that the dogs are emptying their bladders, because I sometimes see these dogs sat in somebody's kennel for 3 to 4 days and nobody's taken care of the dog's bladder, and this can be a huge issue because you can end up with infections, you can end up with the dogs having overflow and go poorly. So you have to remember about the bladders. So this is just to show you a little bit about dog diapers. The dog on the top, that's actually not a diaper, it's just a belly band because he's a male dog. So these belly bands are reusable and you can put a little pad in them, and then that helps to keep the skin around the area dry. But still, it's a problem when they're wearing diapers, and they often will have problems. And then the other dog obviously has a full-size diaper on. And these are available from most pet supplies now. When I first started practicing rehab, they weren't. But here's our challenges with the skin, right? We have to keep it clean. The urine can get trapped on the skin, and even with the diapers, that can be a problem. So frequent bathing is often required. And I will also have my clients use baby wipes just to wipe these dogs down in between times. It's very, very helpful. But no matter how good you are at taking care of these dogs' hygiene, many times these guys get pressure sores. Now, these two little corgis are up on raised beds, and these are rather nice little things to have a look at. These are sort of specialty items, but they are very, very nicely padded. They're raised up so that they're not on the floor. So if there is any urine, it's going to, get through there. But anyway, symptoms of pressure sores, what are we going to see? We're going to see hair loss, discoloration of the skin, some pain, maybe a reddish pink or brown stained fur from blood or pus, maybe a foul smelling wound. That's never good. Increased inactivity. So these dogs are painful with these, and they're just not moving around. The skin can be thickened. We can get an actual open wound. We can get pus that's draining from the wound. But we do see these pressure sores anywhere that the bones are really going to be in contact with the skin with these poor old dogs who have lost muscle. So this picture of this greyhound is just showing you common areas where pressure sores develop. So you see that's really over a lot of the bony prominences that we need to have a look at. So any of these places you can be looking for pressure sores. Now, prevention is, of course, the best option, but sometimes these dogs are going to come in with the pressure sores. So this picture you've already seen, but you see when we're dealing with these guys, we like them on really soft bedding. We like them to be turned every couple of hours if they're not moving around on their own. And we have to try to get away from the pressure onto the skin. So sometimes that actually requires some surgery. But this is just my little list of what we can do to help prevent these sores, or if we are starting to get them, what do we do? Well, as you could see where they would develop on our picture, and they're developing because the animal can't shift the weight and doesn't really feel pain there to know to shift the weight. So if we use some of these orthopedic beds, very, very padded, and then doing some passive exercises, we'll talk a little bit about that a bit more. That keeps everything moving, keeps the circulation going, moving the dog around, turning every couple of hours. And we want to decrease the opportunity to drag. So we may have to use a drag bag. We may have to use some kind of harness or assistive device to get the dog up. And then with wound healing, these are our little donuts that we would talk about using. So you can make these up, and if you're trying to close the wound at least partially by first intention, that's what you would like to do, then you can use some of these donuts basically to keep away from the pressure sore, so that we can really have an idea of what's going on with our sores. And because some of these, if they're primarily closed, it's really a good thing for the patient. And our honey bandages, when we have these sores, can be very, very effective. And I don't know why this is not wanting to go forward. There we go. Okay. So why honey? So if we are looking at these type of issues with dogs, there's always something that we want to put onto our wounds. Sometimes we just want them to be dry. If the wounds are very effusive, it's a good idea to use things like honey, because honey is a great thing as an alternative to antibiotics because it is naturally antibacterial, and it has a great anti-inflammatory activity. Now, there are specific requirements as well for medical honey, and we'll talk a little bit more about that. But why are we concerned? If we have antibiotics, why do we care? Well, antibiotic therapy is becoming much more ineffective now. And the last dog that I had to treat a pressure sore on, we cultured this dog, and there was only one antibiotic that this dog was susceptible to. And of course, we got the culture back in about 4 or 5 days. And that one was a very toxic antibiotic. We did, however, use honey. By the time we got the culture results back, we already the wound was already closing quite well, just with the use of our honey bandages. So anyway, we can get a lot of this resistance to antibiotics, and this is really a very widespread problem. And there's very little progress in development of new antibiotics. So ideally, we would want to use something that's going to help these effusive wounds and is not an antibiotic. So this is why honey has become a very serious alternative for this. We have potent bactericidal activity. There appears to be no resistance against honey, and successful application on infected wounds that don't respond to antibiotic therapy, because the honey is hyperosmotic and it does draw the fluids out of the wounds. So this is a little slide that sort of tells us how it is that honey works against bacteria. Well, we do have sugars in the honey, about 85%, and then we have these great honey enzymes, right, that are in there, and the honey is also a low pH. So all of these things combined together have an effect against bacteria. There's also a slow release, low levels of hydrogen peroxide with the honey. Because it's a slow release level, there's no real risk for tissue damage at that concentration. Because I'm sure you know, if you put hydrogen peroxide onto a wound, that it tends to bubble up and it tends to cause some actual damage to the tissue. But when you're using a honey solution for this, it's actually mediated by the enzymes, and that will slow down. It's a slow release level of the hydrogen peroxide. So it's still going to be antibacterial, but it's going to be very, very kind to the skin. So that's a very important thing when we're looking at these dogs who we don't want to kill off granulation tissue. We don't want to make the skin worse by using something like hydrogen, straight hydrogen peroxide, but by using honey with its release of low concentrations of this, there's no risk for tissue damage. So our honey enzymes, we know that the honey enzymes are in there, and the one that's in there is glucose oxidase, and it is an enzyme that is added to the honey by the honeybees, and it becomes active in diluted honey. So our honey glucose is the thing that's going to be converted into the hydrogen peroxide and the glucuronic acid. So you can see in our little chart here, our glucose oxidase enzyme, we're going to take glucose and water, and the products of that are going to be your glucuronic acid and your hydrogen peroxide. So that's going to drop the pH of the wound, and it's also going to have our slow release antimicrobial protection of the area. So this is all good that I'm telling you about this, and you're like, well, okay, so maybe you're right, Jan, and maybe you're not. Is there any evidence that this actually works? Well, the people at Vetramil have tested their honey to see if it actually does what we think it should do. And they have done a number of tests, but this one that I'm going to show you here is basically a challenge test. So they added 1 million bacteria to 1 gram of honey, and then they carried out the bacterial count after 2 and 7 days. So they wanted to see if we stick these bacteria into this and we challenge it with honey, does it do anything? Does it decrease it? Does it increase it? Does it do nothing? So here are our results. And this is against 2 different types of bacteria, Pseudomonas aeruginosa and Staph aureus. And as you know, those are very common bacteria that we do see in veterinary practice and certainly in skin issues. We see a lot of staph, and of course, we see a lot of Staph aureus on the skin of dogs, and Pseudomonas aeruginosa is seen certainly on the skin, and when it's on the skin, it's horrible, but we also see it a lot in ear infections and ear problems. So we can talk a little bit later about using a honey ear product, because the Vetramil people do have an otic product, and it's extremely effective against Pseudomonas. So if you have a look at this graph, you see that the number of organisms that were reduced even by day 3 of the Pseudomonas, and by day 14, we have really reduced the numbers, and by day 28, they're basically gone. So this is kind of, to me, this is kind of an amazing thing that you can use something as natural and wonderful as honey and still get a really good antibacterial activity. So this particular, our honey that we were testing, the Vetramil, is also very effective against yeast and mold. So you can understand that, well, we have Candida albicans and Aspergillus there. These were the ones that were tested. So if we have these on our patients, wherever they are, our Vetramil ointment is going to be quite effective. Certainly within just a couple of days, it's reducing our number of organisms, and within 2 weeks, we've really reduced quite a bit of the Candida. The Aspergillus is a little bit more difficult to deal with, and it is a more difficult organism to get rid of. Fortunately, we don't get a lot of topical aspergillus, but it would be nice to get rid of all of this, but at least we've reduced it quite a bit with that. So honey also has anti-inflammatory properties, which is a really good thing because we do know when we have these wounds that there's a lot of inflammation, and the inflammation is caused by the oxygen-free radicals, and they are producing a lot of nasty things. And the honey contains antioxidants, right? So the honey works against these free radicals. And, you know, the flavonoids and organic acids, these are all really things that are contained in our honey. What happens with that? Well, when we apply that to the wound, it decreases the inflammation. It's going to decrease our mediators of inflammation, things like our tumor necrosis factor alpha and our thromboxane and things like that, that we are going to see as inflammatory mediators in our wounds. The honey will act against that, helps to clean the wound environment and decrease the inflammation. Now, specific product demands for wound ointment in animals. What do we really need? If we are developing a product to use in animal wounds, what do we really need? Well, we need something that's going to stay on in a wet environment, right? Because these wounds are oozy and yucky. Our patients tend to lick them. So we would really like it if our honey ointment prevented licking, because you can imagine if you put a just regular honey from the grocery store on a dog's front leg because you're trying to treat the wound, the dog is probably going to lick it even more because they're like, you know, there's something on my leg, I'm going to lick it, it tastes great. But what would we like? We would like it if it stayed on in a wet environment, if the patients didn't lick it, and if it repelled insects, right? Because we really do not want flies. That's not particular importance usually for our indoor small animals, but certainly if we're using this ointment on large animals, on cattle, on horses, animals that are outside, that's probably more of an important thing, but still you can get insects inside as well. And we would like it to have excellent wound healing capacity and be a strong antibacterial. So these are all of the things that we would like in a wound ointment. And our Vetramil ointment for wounds and skin contains actually all of those things. So how does this work? Well, it's indicated for our wounds, for our skin problems and abscesses, and it's really best for exudative wounds. If you have a dry wound, the honey's not quite as good because it does tend to be drying. But if you have a really exudative, yucky wound, that's where your honey ointment is going to work the best. These are all the animals that it has been tested in, which is dogs and cats, birds, rabbits, horses, cows, sheep, all of these. So not only our small animals, but also our large animals. And the active ingredients in the Vetramil, we have the honey, which we know is going to promote wound healing and combat our wound infection. But the other great thing that's been added to this product is some essential oils. Now, why would you want to add those? Well, you want to add those because the essential oils give this ointment a bitter taste, and that prevents our patients from licking it. And if you're going to prevent them from licking and disturbing the wound, that's an excellent thing to do. So if you're using this ointment, you do not then have to spray something like bitter orange or bitter apple or something on the wound as well, which may be painful and sting, but this is already in our Vetramil ointment. So it's going to have a bitter taste to prevent licking. The essential oils act as well as an insect repellent. And so that's an extremely important thing, as I said, particularly for our large animals that are outside, exposed a lot more to insects than our indoor small animals, although we can have some outdoor small animals as well. The essential oils also add an antifungal element to this ointment, and they add to the antibacterial. So by combining the honey and the essential oils, we have been able to get all of the things that we would like for a wound healing ointment. Now, these are basically the various presentations for our Vetramil wound care. So we have the 2 different sizes of ointments, and I do tend to use the ointments for a lot of the pressure sores because these are on wounds that we are changing the bandages on every day, maybe every other day. But I prefer to change them every day and reapply them, because when the wounds stop being really exudative, then we may just go to something like a wet dry bandage, or we may go to some other advanced wound care, but we need to know when to apply our honey, when not to apply it. The honey spray I have used a lot in animals that have hot spots, because it's very easy for the clients to spray that on, and they can use it in the larger areas that may be difficult, something that you really can't be bandaging, and not necessary to touch the animal. Important in, say, some of those dogs that really don't want you to touch wounds that they have, or if you're treating horses, sometimes that's an important thing as well, because you really don't want to be attacked or trampled by your patient, right? So here's our final key factors for Vetramil. It has the medical grade honey that has reproducible high enzyme activity, low pH, a high antioxidant level, and low water content to attract the wound moisture. So the honey that's in this is medical grade. So those are all the things we really want in our medical grade honey. And these are really not going to exist extremely well in our over-the-counter honey that you're going to buy at the grocery store. So that's why it is important to use something like Vetramil that has the medical grade honey in it. So it has our medical grade honey. It's going to enhance our skin repair because of the essential oils. The fatty composition of it does prevent washing away in rainy conditions. And although this is not as much of an important thing in our dogs and cats, it is going to be quite important in our horses and in our cattle. And I do say, because I put my rehab patients into the underwater treadmill, I don't usually put them in if they have open wounds, but sometimes we will put something on them, like our honey bandages, and then a Telfa or something that's going to be water repellent, because we still want to get some activity out of these animals. And then I have a very good thought about using Vetramil for this, because I know that it's going to help seal things. Our bitter taste is going to prevent licking, so that our patients don't ingest the honey and continually bother at the wound and delay healing. Again, an insect repellent with essential oils. And one of the things, of course, is it contains no antibiotics. So those are really the key factors for this. Now, it's great to talk about all these things theoretically, but it would be really nice to have a look at some of these cases. And this is a little case that we have followed up for 28 days in this dog. And this dog had a wound that has a fairly good granulation bed, but you can see at time 0, it's rather exudative. They've tried to sew some of it together, actually staple some of it together by to get first intention wound healing, but it has not been, very successful. But with applying Vetramil ointment, you can see the contracture of the wound at 8 days and at 12 days, and then at 24 days. By 28 days, this wound is really quite healed. And you can see throughout the healing that this is very, very clean, and obviously that the patient has not been able to get at the wound. Now, this is an equine case, and so this is a Portuguese horse. And I don't know how many of you treat horses, but if you do, horses do seem to get a lot of wounds. And this wound was followed for 15 weeks. And this particular horse has quite a large wound. You can see that based on the size of the horse's halter with this. So you can see that it's contracting a fair bit after 4 days, still fairly exudative though, and still fairly exudative at 1 week. At 2 weeks, it is about 20% healed, and it continues on to 2.5 weeks where it's really shrinking down. By the time we get to 11 weeks, this wound is only about 25% of what it was originally. And then at 15 weeks, you can see it's totally closed, which is always a great thing when you're dealing with these equines. So what about evidence for this honey product? Well, we have to realize that the Bee Factory does develop both human and veterinary wound care products, and that the human products are registered as medical devices in Europe. They are not registered as medical devices in the United States or Canada, as far as I know, but they are registered as that in Europe. Now, all of the veterinary products were developed and tested in cooperation with veterinary clinics and also academic centers. So some of these publications and some of these things are open access, and you can have a look at them. If you look at PubMed, you'll be able to read these. This first one is honey for the treatment of skin wounds, and you should be able to access that one. The anti-inflammatory processes of honey, this is a very interesting article that came out in 2014, and I think it's not a journal that many veterinarians would read, Food Research and Technology, but I think it's a very good paper to have a look at. And then ones that were done on Vetramil specifically, these ones are listed. These ones are listed here. Some of these have been published in languages other than English. And there is a very interesting paper that's published on the ear product, the combination of honey and propylene glycol that you can use to treat chronic wounds and also to treat otitis externa. And that's actually the Vetramil Oris product. And we weren't really talking about otitis externa today. However, sometimes our patients do get it, and I have to say that I am very happy to treat ear infections with this because I'm always concerned about antibiotic resistant, and some of these cases I'm quite concerned about ototoxicity, which we are not going to have with this, but which you can have with some products. So we're going to go on and talk a little bit more about our paralyzed dogs. And we've talked about some of the challenges faced by the owner, one of them being wound care. So I think we've talked about that quite a bit. But the dogs themselves have a lot of challenges. If you take a very active dog and the dog becomes paralyzed, this can be a very difficult thing, not only for the dog, but also for the owner, because these dogs can become bored. And what do dogs do if they're bored? Well, if you have a dog that's bored at home, that dog can go around and chew on things and eat things, and that's sort of their separation anxiety. But these poor dogs that are paralyzed, the only thing they can do is really lick their front legs, and you can get problems with them, creating a lot of these lick granulomas because they're bored. Also, the separation anxiety many times gets escalated with these dogs because suddenly they can't move around, they can't do things that they would like to do, and if their person isn't there, if they're left in a cage or something like that at this point, not just done with them, then they do have heightened separation anxiety. So it's important to think about the fact that these dogs do very well if they are put in carts so that they can still move around, that they can still maybe play things. And I'm going to show you some videos. I happen to own a paralyzed dog, so I have a video of him in his cart. But what will happen in a lot of cases is if these dogs can still get out and move and can get out in a cart, move around, then they still feel like they're dogs, right? And that makes them feel much better. And the clients are also very happy about that as well. Other things you can do, say you don't, your dog is healing, you're not really wanting to put him into a wheelchair. Some of these dogs are great if you take them out in like a stroller, just so that they can get outside. They can get outside, they can sniff the air, they can see what's going on. So things like that, strollers, assistive devices. There's a really good one that I like that's called a Help 'em Up harness, and I'll show you an example of it. And it is absolutely fabulous because it allows us to get these dogs up, to move them around, and it also allows even small people to be able to still keep their dogs and be able to get them in and out of the house and up and down stairs without throwing their own backs out. And then there's other therapies that we can do with these dogs, things that we can do with them to challenge their brain and also to get their muscles moving. And we'll talk a few things about that. So carts can be fun and they can get the dog up. So here is our little dog. This is my dog, Buddy. And he loves to get out in his cart, and he can really motor. And he came to me as a paralyzed dog. We actually made him into a spinal walker, and he's now 15, so he can't walk quite as well as he used to be able to. But in his cart, he certainly can motor. So he's like, oh, wait a minute. Now what am I going to do? Better turn around and go back the other way. So anyway, he does enjoy getting out. He can still get to the dog park. These are really, really good things. You do have to watch when you're using a wheelchair that you don't get any rub spots with them. But I have to say that for dogs like Buddy, wheelchairs are a great thing. Whoops, we don't need to see it again. So this is a Help 'em Up harness. So I was talking to you about other things you can do for the dogs. Now, this is Cooper, and Cooper did have a disc issue, which we treated him for, and he did recover, but he is a great big dog. He probably weighed about 75 pounds and was owned by a very small woman. So this particular harness, it almost acts like a suitcase. So you can hold the front part of it and you can hold the back. We often will put, if the dog is walking fine in the front end, we often will just put a leash around the back end handle so that you can actually kind of walk the dog, and he's still then able to get out. He was able to get out to the dog park. He was able to get out to where the client wanted him to. So that's a Help 'em Up harness. Now, booties, I'm sure you have seen lots of dogs with booties and things that are going to be able to protect their feet. And these are very important. I mean, I do live in Canada, so we will like to put booties on our dogs sometimes just because of the snow and the ice, but also with these dogs, because they have neurological disease, many times they're scraping their feet, and that's not going to be very helpful. So the booties are going to help to protect the pads, but they're also going to help to protect the feet. You know, the Vetramil makes a pad wax as well that's for the feet, and has a is really good for dogs in cold weather. But you could also use it if you're having dogs who are scraping nails and scraping their toes. That is going to be helpful too. But remember, there's things like power socks that you can use. There's booties, those kinds of things that are going to be very, very helpful for these dogs, because you want to take care of their skin, but you want the dogs to be able to get out. So this was one of my patients, and this dog was down and paralyzed. He had had surgery. He had had surgery for a cervical disc issue, and his referring veterinarian, and where the client lived, was about 7 or 8 hours away from my rehab facility. And this dog had had surgery, but just kind of laid in the kennel. He couldn't get up. He couldn't really do anything. So he came for me to evaluate him, and this dog's name is Prince. So we evaluated Prince and had a look at what was happening with him. And he did, at that point, his nerves had healed. He was just very weak. He was unable to walk. And not only he was depressed, and he was like, I'm never going to walk again. I can't walk. I can't move. I can't get out. So we actually kept him at my rehab facility for about a month. And this was him when we first got him in. And I needed to have 2 staff members in the treadmill with him, making him move his muscles. See, we're using a sling, we're using the water to hold him up. We're trying to convince this dog that he actually can walk. So that was what we did with him initially. So this was about 10 days later. Now I just have 1 person in there with him. So he's regained some strength with his muscles. He's walking on his own. She's not having to pattern for him anymore. She's just helping to hold him up, which is exactly what he needed. Now, this dog really wanted to go outside because he's a husky. So what did we do? We put a harness on his back end, and here's one of my staff members helping this dog to walk around. And he loved the snow because he's a husky dog. And without being able to get outside and not being able to get in the snow, he was very, very depressed. So this was extremely helpful for him. So when we're doing rehabilitation, we need to not only think about what's going on with the dog's legs and all that kind of stuff, we also need to think about what's going on with the dog's brains. Oops. Yeah, okay. I don't have the last. I had one more slide from Prince, where he actually totally recovered all of his function, and basically we took it on the last day, and he was running around ready to go home. So some of the other things you can do, what else can you do? You can put these harnesses on and get these dogs to move. You can move their legs, do that sort of thing. I have a couple of assistants here who are doing something called assisted standing with this particular dog. And see, he just pushed himself up there himself. But what she's doing is she's positioning him, giving him lots of love, lots of positive reinforcement, because that's what these patients really need. So what other things can you do to stimulate these neurological patients? Well, you can use like a small vibrator or an electric toothbrush that you're going to use to stimulate weak muscles. Obviously, if you're using an electric toothbrush, don't use the end that has the toothbrush part on it. You don't want to get it caught in the hair, but you can actually use that on the weak muscles. You can tap over the muscle bellies, and that's going to help to stimulate our muscles to contract. You can also use postural reflexes, things like wheelbarrowing and hopping. Those are going to be very, very useful. You can wrap a tensor around the patient or use one of these Surgy Snugglies or Thunder shirts that will be very helpful. So the idea with that is you're trying to connect the front to the back of the dog and create awareness that the two ends are still connected. So this is what we use these tight shirts for, or you can actually use a tensor. Any kind of sensory stimulation that you can use on the dog is going to stimulate all of the superficial receptors. And, standing the dog up, that's going to be something very, very important to do as well. And don't forget to counsel your clients to do lifestyle changes, because these dogs that you're trying to get to recover, they don't do very well on non-slip, on slippery floors. So what we really need is non-slip floors. And we need to make sure that they're not going to be falling downstairs. So we need things like baby gates to help them. We want to make sure that they're, no stairs or jumping. It says are jumping. It should say or jumping. We don't want that. Those things are very important. Good idea to try to elevate the dog bowls so that these patients are not having to bend over. So we really can be helping them and doing things for the patients themselves. So this basically is a little slide that's going to tell you about some resources for your honey products. If you're looking at some of the honey products that we've talked about today, this is your website, and you can, certainly we have them in Europe. It's also now in the US, and that's where you can get it through that. You can mostly get these things now through veterinary suppliers, which is a really good thing to do. And then this is just my slide that you may be interested in for some other resources for these paralyzed dogs. I haven't really talked a ton about other things, but Dog on Wheels and Eddie's Wheels make great wheelchairs for these dogs. We can also get them from Paw Prosper. That's where we get ours from now. And they will give us our Help 'em Up harnesses, our wheelchairs, our lasers, our Respond beds. And then Therapaw also are the ones who will make our booties. And I didn't show you any slides about laser, but laser therapy is very, very good for your paralyzed dogs. It helps to promote axonal sprouting, really good also for wound care. And a lot of times when we're doing wound care, before we're putting the bandage on, we're lasering these patients, because that helps an awful lot to get everything to heal. But if you have questions about paralyzed dogs, different things that you want to do, I would suggest as well that you have a look at some of the education for rehabilitation. I'm a professor at the Chi University, and we do teach rehab and acupuncture, which are great things for these paralyzed dogs, and always happy to talk to anybody about what is my passion. So I want to thank you for your attention, and by all means, if you have questions, please email me.
Thank you, Dr. Huntingford, for this impressive and interesting presentation. For me, it's very useful to see how our honey-based Vetramil portfolio is linked to the dog rehabilitation practice. That's really useful. So thank you for that. Also, thanks to all of you out there listening to the webinar today. As a reminder, Please submit any final questions you have, and Dr. Huntingford will reply to them via email after the broadcast. When you exit the webinar, a brief survey will appear. If you would like more information about Vetramil or receive a free sample of Vetramil's most popular honey product, please indicate that on the survey and our team will contact you directly. Keep an eye out for an email from Vetramil over the next few days with an on-demand link to today's recording and a 20% off coupon code that you can use for your first order. Thank you for attending, and I wish you a great remainder of the day. Bye-bye.